I'm about to share something you can try on tonight that may help lower blood pressure, especially if stress is a big part of what's driving it. But before you roll your eyes and think, it's probably another diet trick or another supplement, let me be clear. This is not me about cutting salt. This is not about walking more. And this is not about buying a bottle of pills. It's a method that targets a system most people never think about. The system that can raise your blood pressure even when you're eating clean, exercising, and doing everything right. And yes, your doctor measures your blood pressure every visit. But most people leave the office with a number and no real understanding of what that number means for their brain, their heart, and their independence. I'm Dr. Claire Whitmore. And after decades in cardiovascular care, I've seen the same tragedy repeat itself in different faces, different families, different homes. It always starts the same way. A person feels mostly fine. Their blood pressure is not that crazy. They avoid medications because they want a natural option. They try a little of everything, and then life changes in one violent moment. Let me tell you about David. David was 69, a retired construction worker. Strong hands, strong work ethic, the kind of man who could build a house from nothing and still have energy left at the end of the day. He also had high blood pressure for about 10 years. His doctor told him again and again, "You need medication." David said, "I don't want pills for the rest of my life. There has to be another way." So he tried the right things. He changed his diet, cut salt down drastically, stopped eating processed food, cooked at home, measured ingredients. His blood pressure improved, but only a little. He was still in the danger zone. Then he started walking every day, 30 minutes, then 45, then a full hour. Again, a little improvement. Then supplements, fish oil, magnesium, garlic, coenzyme Q10, bottles and bottles. Some days his readings looked better. Other days they didn't. And slowly, David started telling himself something that is incredibly common. At least I'm doing something. At least I'm trying. But here's what David didn't understand, and what almost nobody explains clearly. Blood pressure is not just a number. It's a force. A force hitting your blood vessels over and over, thousands of times a day, every heartbeat, every hour, every week, every year. And when that force stays high long enough, it can damage vessel walls in tiny ways you will never feel. No pain, no warning, no symptoms, just damage quietly accumulating, especially inside the brain. Brain vessels are delicate. They're not designed to take that pounding forever. So what happens? Over time, weak spots can form, tiny bulges in vessel walls, areas that become thinner, more fragile, more vulnerable. And then one day, something spikes the pressure. Stress, poor sleep, dehydration, an argument, even just standing up quickly. And that weak vessel can rupture. That's exactly what happened to David. One evening, he stood up to go to the bathroom, and a headache hit him like a blast. Not a normal headache, an explosive, terrifying kind of pain. Then his right side went numb. His arm stopped working, his leg collapsed. Words disappeared. His wife found him on the floor, face drooping, unable to speak, eyes full of panic. The paramedics arrived and his blood pressure was dangerously high. At the hospital, the scan showed bleeding deep in the brain. And in many cases like this, surgery isn't even possible. So the doctors do what they can, control the pressure, reduce swelling, try to prevent more bleeding. David survived. But he didn't return to his life. Weeks became months. Months became years. He lost his independence. He needed help with everything. He could say a few words, but conversation was gone. And the part that haunts families the most is this: the person is still alive, but the life they had is gone. Now, here's the sentence I want you to hold on to. David's stroke was likely preventable. Not because he was lazy, not because he didn't care, not because he didn't try. He tried hard. He just never targeted the system that was keeping his pressure elevated in the first place. So, what system is that? Here's the core idea. Your blood vessels have muscle in their walls. That muscle can tighten or relax. Tight vessels create more resistance. Pressure rises. Relaxed vessels reduce resistance. Pressure falls. Most people think food controls that muscle, or exercise controls that muscle. Those things can help, but often they do not address the main driver: your nervous system. Specifically, the sympathetic nervous system, your fight or flight response. When it's activated, your body releases stress chemicals that tell blood vessels to constrict. That's useful in emergencies. But if your body is stuck in that mode, day after day, your vessels stay tighter than they should, and blood pressure stays higher than it should. That's why some people can diet perfectly and still struggle. And this is where the method comes in, because it targets that nervous system directly. But I'm not going to rush past the most important part, because this only works if you actually do it. Now let me tell you about Patricia, because her story is the opposite of David's. Patricia was 67 years old. Her blood pressure was consistently high enough that her doctor said, "We can't wait. You need medication now." And here's the key difference. Patricia didn't just say, "I don't want pills." She asked a better question. She asked, "Why is my blood pressure high in the first place?" Not what lowers it temporarily, not what masks the number, but what is actually pushing it up inside my body. And that question led her to something most people have never been taught. She learned that when the sympathetic nervous system stays overactive, day after day, it keeps blood vessels in a semi-contracted state, not tight enough to feel pain, not dramatic enough to cause symptoms, just tight enough to keep pressure elevated. And unless you calm that system, pressure stays high no matter how clean your diet is. That's when Patricia came across research on slow, controlled breathing. Not meditation, not positive thinking, not random deep breaths. Very specific breathing. Exactly 6 breaths per minute. At first, she thought it sounded ridiculous. Breathing, that's it? But the studies were clear. Slow breathing at that pace increases something called heart rate variability, a marker of a calmer nervous system. When heart rate variability improves, blood vessels relax. When blood vessels relax, resistance drops. And when resistance drops, blood pressure follows. So Patricia made a decision. She didn't try it when she had time. She didn't say, I'll see if I remember." She started. That same day, 15 minutes in the morning, 15 minutes in the evening. Nothing else changed. Same food, same activity level, same body weight. 2 weeks later, she checked her blood pressure. It had dropped dramatically, not by a few points, by more than 20 points on the top number. She thought the machine was broken, so she checked again and again and had her doctor confirm it. The readings were real. She kept going. Week after week, her pressure continued to fall. Within about 6 weeks, her numbers were near normal. No pills, no side effects, no expensive programs, just consistent breathing that retrained her nervous system. Years later, she's still doing it. Her blood pressure remains controlled. Now, before I give you the exact protocol, I need to show you why. Timing and consistency matter. Because knowing this method is not enough. Let me tell you about James. James was 71. His blood pressure was elevated, not as high as David's, but high enough to be dangerous. His doctor explained the same breathing method, gave him clear instructions. James nodded, went home, put the instructions on his kitchen counter, and thought, I'll start tomorrow. Tomorrow became next week. Next week became next month. Life got busy. 6 months passed. James never started. Then one morning, his left arm felt numb. By the time help arrived, he was having a major stroke. James survived. But like David, his independence did not. And here's the part that destroys people emotionally. James knew what to do. He just didn't do it. That's why I need to be very clear with you right now. This method only works if you actually practice it daily, not occasionally, not when you remember, not when it's convenient. Because what you're doing is retraining your nervous system, and nervous systems learn through repetition. Now, here is the exact protocol. This is simple, but precision matters. Sit in a chair with your back supported, feet flat on the floor, shoulders relaxed, close your eyes. Breathe in through your nose for 5 seconds. Count slowly, then breathe out through your mouth for 5 seconds. No forcing, no straining, just smooth, slow breathing. That is 6 breaths per minute. Do this for the 50 minutes, twice per day, once in the morning, once in the evening. Set a timer, do not guess, do not rush. During the session, you may feel calm, heavy, or slightly sleepy. That's normal. That's your nervous system shifting out of fight or flight. Most people begin to see changes within about 2 weeks, some sooner, some later. But consistency is everything. Now let's talk about what you should realistically expect when you start this. Because I don't want you guessing, and I don't want you quitting too early. Most people do not feel dramatic changes on day 1. This is not a stimulant. This is not a drug. This is training. And training works over time. What usually happens in the first week? In the first few days, the most common change is how you feel, not the numbers. People report deeper sleep, less tension in the chest and neck, fewer stress spikes during the day, feeling calmer for no obvious reason. That's a good sign. It means your sympathetic nervous system is starting to quiet down. What happens after about 2 weeks? Around the 2-week mark, many people see measurable changes, not everyone, but many. The top number often drops by 10 to 15 points. Some see more, some see less. But the direction is almost always downward. And here's the important part. If you stop at this point, the benefits fade because your nervous system hasn't fully reset yet. That's why people who say, I tried breathing and it didn't work, usually stopped too soon. The 6 to 8 week window. This is where the real change happens. By 6 to 8 weeks of daily practice, the nervous system adopts a new baseline. Not relaxed sometimes, relaxed by default. Blood vessels stay more open, resistance stays lower, pressure stabilizes. This is why people like Patricia and Susan maintained normal readings for years. They didn't do it once. They made it routine. Who needs to be careful? Now I need to say this clearly and responsibly. This method is powerful, but it does not replace medical care overnight. If you are already on blood pressure medication, do not stop your medication on your own. Instead, Track your readings, bring them to your doctor, let adjustments be made safely. Some people eventually need lower doses, some need fewer medications. But that must be done with supervision. Breathing calms the system. Medication manages the numbers. They can work together. Who benefits the most? This method is especially effective if your blood pressure rises with stress, your readings fluctuate a lot, diet and exercise helped a little but not enough, you feel wired but tired, you have trouble relaxing. These are all signs of sympathetic overactivity. And that's exactly what this targets. However, why this works when other things fail? Diet works on chemistry. Exercise works on metabolism. Breathing works on a control. It tells your nervous system, you are safe, you can stand down. And when that message repeats every day, the body listens. That's why this feels too simple. But simple does not mean weak. It means direct. One final reminder before the closing. If you remember nothing else, remember this. Knowledge does not protect you. Action does. David knew his pressure was high. James knew the method. Only Patricia acted. Tonight, after this video, sit down and start. 15 minutes. Set the timer. In through the nose for 5. Out through the mouth for 5. Do not wait for motivation. Do not wait for the perfect moment. Your nervous system doesn't need perfection. It needs repetition. Now let's finish this properly, because how you do this daily and matters just as much as knowing how. The ideal daily schedule. You only need 2 sessions, morning and evening. The best time in the morning is before the day starts, before emails, before news, before stress. The best time in the evening is 1 to 2 hours before sleep. Not right after eating, not while watching television. Make it a quiet moment. Chair, timer, eyes closed. Same times every day. Your nervous system loves consistency. The most common mistakes that stop results. Let me save you months of frustration. Mistake 1. Breathing too fast. If you rush the breath, you stimulate stress instead of calming it. Mistake 2. Doing it sometimes. 3 days on, 2 days off does not work. Mistake 3. Quitting when you feel better. This is training, not treatment. Mistake 4. Checking blood pressure too often. Checking every hour creates anxiety and raises pressure. Once per day is enough. What to do if numbers don't change first? Do not panic. Some nervous systems take longer to reset. If after 4 weeks you see no change, make sure your timing is correct. Confirm your breathing pace. Ensure sessions are full 15 minutes. If after 6 to 8 weeks there is still no improvement, that is a signal, not failure. A signal that another factor may be involved. Sleep apnea, medication imbalance, hormonal issues, kidney involvement. At that point, bring your log to your doctor. The breathing still helped by revealing the real problem. What this method really gives you. This is not just about blood pressure, it's about protecting your brain, protecting your independence, protecting your future. Every stroke story you heard today had one thing in common. The warning came first, and the people who listened survived with their lives intact. Writer of Rare, your commitment moment. Right now, make a decision, not a promise to me, a promise to yourself. Tonight, set a timer, sit down, breathe slowly. 15 minutes, that is all. You do not need equipment. You do not need supplements. You do not need permission. You need consistency. Final call to action. If this video helped you, share it with someone you care about. Subscribe so you don't miss the next lesson. Turn on notifications. Next time, we'll talk about foods that quietly amplify this effect and support vessel relaxation naturally. Thank you for staying with me. Now close this video, sit down, and start breathing. Your future self is depending on it.